Just this past year, the Surgeon General reported a strong association or gave a warning about alcohol exposures causing cancer. And so there's a direct link now between alcohol exposure, meaning drinking, and the risk of developing many different types of cancer, including liver cancer. So my name is Michael Golding. I'm a professor in the Department of Physiology and Pharmacology in the College of Veterinary Medicine and Biomedical Sciences at Texas A&M University. What our research has focused on is trying to understand how alcohol exposures early in life, or in the case of the dad, even before conception, can cause a memory to transmit across to his children, which then is going to increase the predisposition or enhance the risk of that child developing cancer. And so what our research has shown is that the offspring of parents who drink have this increased inflammation. So they have more arthritis, more inflammatory diseases, and what we did in this most recent study was to show that this increased inflammation actually comes with an increased risk of the children developing liver cancer when they get into adulthood. What we're trying to do now is take a step back and look at other types of cancers to see if we can find an association there. And so there's a really strong correlation between heavy alcohol use and the development of breast cancer. And so we're now looking to see if mom and dad's drinking transmits a memory to his children or her children that increase the risk of developing breast tumors. One of the questions I get more often than not is how much drinking is actually responsible or can drive this effect. And in truth, we really don't know. And I think it's going to be different for different people. But generally speaking, anytime that you are chronically drinking, having more than, say, 5 drinks in a week, where you're always going to have that kind of chronic low-level inflammation caused by alcohol, I would say that you're at risk for having this effect manifest in you and then passing that memory on to your children. Risk mitigation for males, we think that the best advice here is for males to stop drinking completely about 3 months before trying to get pregnant, or 3 months before conception. And the reason that we say this is that sperm production in humans takes around 60 to 75 days, and so you really want to have a period for the alcohol to wash out of your system and then have a complete cycle of sperm production during that period where you've been washed out, in order for it to maximize the chances that you will not pass on a risk to your children. Now for women, it's a little bit more complicated. The way that a woman generates her oocytes is when she's pregnant inside essentially your mother, and so it's going to depend upon your grandmother's exposure and the mother's exposure as well to determine whether or not the risk manifests in her children. Abstinence from alcohol when you're thinking about getting pregnant or planning to get pregnant is the best course of action here, and this includes both the male and the female. And anytime that you can eliminate a potential risk factor, the odds of it coming through or having an impact on your children is dramatically lessened.